All right, you guys. Hello, hello. Happy Thursday. My name is Hiva Kolodrubetz. For those of you who don't know me, give me 2 seconds. All right, I am going live on our Instagram, TikTok, YouTube, as well as Facebook channel. So welcome, welcome. Again, for those of you who don't know me, my name is Hiva Kolodrubetz. I'm a family nurse practitioner. And here at Archer, we've been busy. We've been doing a lot of great things, including growing our Archer community, our Archer educators. And one thing that we wanted to bring to our Archer nurses and nursing students is more advanced practice content as well. So we're merging our channels. And so today, for those of you who are joining me on socials or through Zoom or all the other channels, I see some familiar names and faces. Hi, welcome you guys. Definitely want you to be mindful that this is for advanced practice registered nursing students. So those currently in school for family nurse practitioner training, adult gerio, primary care. This is more advanced practice. So for those of you studying NCLEX, feel free to stay and join and participate. I think any kind of learning is really going to contribute to your overall knowledge, medical knowledge. But remember, we're not talking about NCLEX today, so don't panic when I show you some of these test questions. These are ANCC and ANP style questions for advanced practice nurses. So hi, Carly, great to see you. Welcome, welcome, you guys. All right, so let me start by sharing my screen, and I'm doing something a little fun today. If you're not having fun, then what's the point of doing it, right? I really wanted to take us through some questions from our question bank so you guys can really see it, play around with it, enjoy it, and it kind of makes it a little bit of a fun game. So I want you guys to be interacting with me in the chat. Answer what you think the answer is. I'm going to show you guys. So when you go to our webpage, archerreview.com, and everybody should be able to see my screen and hopefully see this webpage, give me a thumbs up, thumbs down. When you go to our webpage, you can go to your student dashboard. So if you don't have one, you can create one. And in your dashboard, you can do a demo of our QBank. Right now, we also have a free psych mental health QBank. But when you're in your dashboard, you can see all these fun things. So one of them being the question bank, depending on which package you purchased. You can also see our on-demand video library. It'll also show you the webinars that are coming up. So this is what we have scheduled for November and December. You have some great study calendars that you can use. So a lot of awesome things here, some CEs associated with our board prep, our one-day live review. But today I'm focusing on the QBank so you guys can see how to navigate this. And this is where our fun is going to come in. So when you create, so what did I do? I pushed this button, create test. And so I'm going to use it in tutorial mode because it's going to give us the answer. We can do timed or not timed, whatever we like. And we can do whichever boards we like. So ANCC or ANP, remember the formatting's a little bit different for these two different boards, but the content is pretty much the same, right? They want to make sure that you have the knowledge to practice in primary care outpatient setting. Then you can pick unused. I'm going to pick all because I just use this account as a demo account. So a lot of the questions that I've used, I've just selected and quickly shown students how to do it. So I'm going to click all so we get a good amount of derm questions, which is why we're here today. I'm not going to limit the patient population. I'm going to select it all, but if you want to practice derm in adults, derm in pediatrics, derm just in geriatrics, you can filter that. And then I'm just going to pick dermatology. So here we go. And let's get started. So you guys should be able to see this in our QBank. Your test is getting ready, and this is what it'll look like. So you do have that timed feature if you want it. You can also mark those questions if you want it, and then hop back to those ones that you marked at the end, similar to the actual test. So say I mark this question, it just tells me unanswered, but it will have a little flag. Maybe this way. There we go. You'll see that little flag. And you can go back to it after you've answered all the questions and think about it and change your answer if you want, similar to what you can do on the boards exam. The other feature I want to point out is this awesome little feedback feature. Oops, that's notes. And feedback feature, and this comes directly to me. So if you guys are doing test prep questions, you're like, hey, this one was too difficult. Hey, this is a little confusing. I need some more, I have some input for you. Please send it my way. I love to see it. So that's how we improve our product for you guys. And that's the whole purpose, serving you, right? Making sure you guys feel good about sitting for your boards exam. You guys are all going to be awesome clinicians. I tell my students that all the time. But you definitely want to make sure that you feel that confidence, right? If I'm just telling you, that's not going to really do anything. I want you to feel confident. So I see a lot of people joining us. Hello, hello on Instagram. And I'm trying to be mindful of the chat too, especially since we're going to play a little game. But we're going to do rapid fire. So I really want you guys to put your answers in there for me. I can see, yes, Sherry, this is for NP students. So great question. Hasn't started yet. I did log in a little bit early. Hi, Anna, great to see you. But this is for nurse practitioner students. So it is on our NCLEX channel. We are merging our channels. So I want to be clear on that. Don't panic if you are seeing NP type questions. You're like, that doesn't look like what it looks like on the NCLEX. You're right. This is for family nurse practitioner and adult geriatric. All right, you guys, put it in the chat for me. I'm going to have you answer. I'm going to pick majority, and then we're going to go through the questions. So on physical exam, the fingernails of a 45-year-old male are rounded and clubbed. Which of the following may cause this finding? Select all but apply. So for those of you sitting for your ANCC board, you may get some select but apply questions, meaning that you can pick more than one option. So go ahead, tell me, what do you guys think, A, B, C, or D? But if we're seeing fingernails on a 45-year-old male, it's described as rounded and clubbed. What do you guys think, A, B, C, or D? What's the right answer? And I will pick majority, what the majority votes. Also, feel free, you guys, to put in the chat who you are, where you are in your training, and what brought you to the webinar today. I love to get to know you guys. I see a lot of familiar names, repeat names, and that's really fun for me, and also helps me tailor these webinars. So I thought, because tomorrow is Halloween, we do a spooky series. So that's about as clever as I can be. But I'm hoping you guys will have fun with these spooky derm conditions. So what do you guys think? I see some answers. Some people are saying B, paronychia. Some people are saying not visible, please make screen bigger. Okay, let's see. Please make the screen bigger. Okay, oh, I see, because it's so small on Instagram. Let me do this. What if I take myself out? Make myself really small. Ooh, then that's too big. Okay, let's do it this way. I don't know if that'll help, but this is good to know. So it's kind of a little bit harder to see the full screen. I apologize. All right, this is why we try, right, you guys? So do your best, listen to my reading the answer, and then we can go from there. Sorry, guys, for those of you on Instagram. So I see a lot of B and D. Okay, I love Archer. It helped me pass. I love to see that. Thank you for sharing. All right, let's pick B and D. So that seemed to be the most popular choices. So B, paronychia, D, transposition of the gray arteries. And then you can hit reveal the answer. And so it'll tell you what those correct answers were. So lung cancer, Crohn's disease, and transportation of the gray arteries. It also gives you the stats on the difficulty level of that question, which I love. We selected dermatology, so these are all going to be dermatology. It'll tell you how long it took you to answer that question, and it'll give you the rationale. Now, today, we're not going to go too in-depth with the rationale, because I really want to make this like a quick fire game. But I really want you guys, when you're answering these questions, to take the time to read through all the rationale, even if you get it right, and then watch the videos, on-demand videos that are associated with it. So I always tell my students, if you're thinking about buying a package, do the combo package, because then you'll get access to those videos in that question bank. It's going to be really, really helpful. So what do all three of these things have in common? Lung cancer, Crohn's, and transposition of the great arteries. Put it in the chat for me, you guys. What do you think? Getting in the car, so listening in for the rest. Awesome, Carly. Yeah, and we have an awesome podcast for those of you who want to be studying while driving. So make sure you check out the podcast. Host is our very own Morgan Taylor. So that's a really nice way to study when you're on the go. I remember I did that as a student with CDs. You guys don't have CDs anymore. You have podcasts now. And I'm dating myself. But what is it? So what are these things really pointing out? So this rounding, this clubbing, what is it telling us? These are nutritional deficiencies, right? So patients not getting enough oxygen, not getting enough nutrients, and that's what all three of these conditions have in common, right? Lung cancer, the clubbing is occurring because of hypoxia. Crohn's disease due to malabsorption, transposition of that great arteries, again, hypoxia, right? So clubbing, rounding of those nails, not a normal finding. Awesome job. What's paronychia, you guys? I can't help not teaching. I know we're trying to be rapid fire, but I can't help. What's paronychia? Oh, and it's on the screen if you can see it. What is paronychia? Have any of you seen paronychia, diagnosed it, treated it, or seen your preceptors treat it in clinic? What is paronychia? Low oxygen. Very good. Yes, they all have low oxygen in common. Very, very good. What is paronychia? That is an infection of the nail bed, right? And sometimes you have to go in and do an incision and drainage if you are trained to do it. But yeah, that's an infection of that nail bed, and it can be very painful for patients. So paronychia is more of an infection. You're not going to see rounding and clubbing. Those are due to long-term deficiency, nutrient deficiency. So that nail has really transformed. Whereas paronychia, you're going to see inflammation and pus building around that nail bed. I love to clean up paronychia, but that's just me. Maybe that's the spooky part of today's webinar, right? All right, next question. I'm going to read it out loud for those of you where it's really tiny on the screen. And again, I apologize. So patient presents at 39 weeks pregnant with rupture of membrane. She has a history of herpes simplex virus, so HSV. On exam, the nurse practitioner documents fetal head engaged, presence of labial ulceration, pooling of fluid in the vagina, and a cervix that is 2 centimeters dilated, and contacting the OB to prepare for delivery. Which of the exam findings creates a high risk that should be reported? High risk, you guys. So out of this clinical vignette that they described, what is the high risk? A, B, C, or D? So A is fetal head engagement, B, presence of labial ulceration, C, pooling of fluid in the vagina, or D, cervix 2 centimeters dilated. What do you guys think? And while you're thinking about it, A, C, C, or D, again, this is not a select all, so this is going to be a one answer choice. Think about what is the question asking, right? I always tell my students, read through the question, then pause, ask yourself, what is this question asking? If you don't know, read that last sentence again and ask yourself, what is this question asking? So this question is saying, when you're getting ready to contact the OB for delivery, which of the exam findings creates a high risk that you should be reporting to the OB, right? Because we really need to be flagging this with the OB so that they can plan the appropriate plan of care. They can press the OR is what the clue that I will give you. So what do you guys think? So, and then go back sentence by sentence, pull out those key words, and really start to think about how would I answer this in my own words? What are we worried about? Let me look at all those channels that we're going live on. What do you guys think? Yes, I see a lot of people saying B. Let's see if that's the right answer. Correct. Awesome job, you guys. Why? Why B? Why presence of those labial folds? Remember, they're telling us the history of HSV. And what do we not want to do with a patient who has active ulcerations due to their HSV, labial ulcerations? What can that do? That can spread to the fetus if we're having a vaginal delivery, right? So labor needs to be done by C-section. When you're calling the OB, you need to let them know that you are seeing some active ulcerations. Patient has a history of HSV, and so OB needs to be prepping, calling the OR, prepping for a cesarean delivery, right? Very good, you guys. Again, read all the rationale, watch the video. This is an opportunity to really identify those knowledge gaps and go back and study. But this is the way derm's going to pop up, right? They're going to describe things that they're seeing, and you really have to be thinking, okay, how does HSC present, right? And how are they going to write it in words? How are you going to write it in your chart, right? That's really important. All right, going to the next one. Which of the following physical assessment findings is not a normal physiologic change for an 82-year-old patient? So this is a geriatric question. Think about it. A, decreased skin turgor. B, thinning skin. C, increased fat. Or D, decreased sweating. What do you guys think? This is a tough one. A, B, C, or D? Which of the following physical assessment finding is not a normal physiologic change for an 82-year-old patient? What do you guys think? What do we expect to see in derm in our geriatric patients as they age? What do you guys think? What do we expect to see? Oh, I see some nurse assessment. Why can't I say that word? You guys do practice in derm. So I want to see some answers. What do you guys think? Remember, for those of us just joining us, this is on an NP level. Okay, I'm seeing some people saying C, some people saying H. We don't have an H as an option, but what do you guys think? A, B, C, or D? All right, we're going to go with C, increased fat. That seems to be the majority. What do you guys think? Awesome, awesome job. Yeah, we expect to see in our older patients signs of decreased skin turgor, thinning, decreased sweating. This is why we worry about them with dehydration, right? And this is why we kind of really want to take them off of SGLT2 inhibitors. If they're type 2 diabetics, get a little bit more lenient, less aggressive with their A1C goals, because we really want to avoid infection and dehydration, so hypovolemia. Awesome job, you guys. Increase fat. Again, we're going to see some muscle wasting. Maybe we'll see some added fat in certain areas, but that's not something that's going to be an expected finding. We might just see more decreased fat and wasting. Okay, awesome job, you guys. 75-year-old woman in an assisted living home has been diagnosed with steatosis eczema on her legs. Which of the following non-pharmacologic therapies is not part of the plan of care? Okay, pause right there. When you're doing these practice questions, you don't know what something is, answer it to the best of your ability, and then take the time to study that content. Research shows that practice questions are the best way to fill those knowledge gaps. You have to identify those knowledge gaps with the practice questions, take the time to study them. And when you're studying, I always want you to think, okay, what am I going to see on assessment? How am I going to diagnose this? What's the plan, and how are we going to evaluate the plan? What's the treatment? When do I need to know if I need to change the treatment or not, right? That's really important. So what do you guys think? 75-year-old female, she's in assisted living. She has steatosis eczema on her legs. And what is the question asking? Which of the following non-pharmacologic therapies is not part of the plan of care? Okay, what do you guys think? A, limit bath time to 10 minutes. B, use antibacterial soap with bathing. C, apply emollient lotion immediately after bathing. Or D, increase intake of water. What do you guys think? A, B, C, or D? What do you guys think? What do you guys think? Looking in my chat. All right. Seeing some responses. Welcome, Jan. Welcome, Karen. Welcome, Pima. Again, this is going to be higher level, but is this relevant for nursing knowledge as well? Absolutely, right? You're going to see these patients on the floor. You're going to have to alert the higher level of care when we're worried about certain things. Absolutely. All right, I'm getting a lot of D. Let's see if D is the right answer. Increase in water intake. So it's, again, what is it asking? Which of the following non-pharmacologic therapies is not part of the plan of care? And this is a 75-year-old, and we're seeing steatosis eczema. So again, out of all of these, the other thing I want you to think about when you don't know what it is, think about patterns when you're looking through your answer choices, right? What is different about B compared to all the other ones? So the correct answer is D. You don't want to use antibacterial soap with bathing. Why? Because that's actually going to dry out that patient's skin more, right? We're already dealing with dry skin. That's what steatosis eczema is. It's drier skin. And so if we use that antibacterial soap, it's going to dry that skin more, right? So what we want to do is increase that hydration of the skin. So we're going to limit that bath time so we're not drying them out. We're going to apply those emollients right after bathing so that we can really hold that moisture into the skin. And then we're going to increase that water intake. So A, C, and D all help with improving that dry skin, right? Whereas B is the opposite of all that. So you can also look for patterns, and then again, you can go back and read more about the skin condition. Very good, you guys. All right, rocking and rolling. You guys are doing great. So a 66-year-old female presents to the clinic to discuss an issue with the antibiotic regimen she started 3 days ago. She was prescribed clindamycin, 150 milligrams every 6 hours for a wound on her leg that tested positive for MRSA. She explains that she has experienced diarrhea 4 or 5 times a day since yesterday, which is exceptionally foul smelling. What action does the nurse practitioner take? All right, let's pause right there. The question is asking what action does the nurse practitioner take? But before answering that, what do you need to do? You need to think in your head, well, what do I think is the likely diagnosis, right? What's on the list of my differential diagnoses? What's at the top of my list? So what are we thinking here, you guys? Put it in the chat for me. What is this patient dealing with? What's at the top of her list? Video is not clear. Oh, I'm sorry to hear that, you guys. Let me see. Maybe I did something funky. Hopefully that corrects the video. Thanks for letting me know, Micah. C. diff, yes, absolutely. We're thinking C. diff, right? This patient is having a reaction to the clindamycin, and this patient has tested positive for MRSA. So what do we need to do? But the diarrhea 4 to 5 times a day, foul smelling, that's C. diff. Very good. What action does the nurse practitioner take? Put it in your own words in the chat for me, and I'll read through the answer choices. Is it A, stop with clindamycin, consult culture and sensitivity report for an alternate antibiotic regimen, order a stool sample to rule out or rule in C. diff? B, instruct the patient to continue with the clindamycin. This is a typical side effect that goes away with time. C, instruct the patient to continue clindamycin but prescribe daily probiotics. Or D, stop clindamycin, start augmentin, so that's amoxicillin with clavonic acid. CID for 5 days. What do you guys think? A, B, C, or D? Hopefully the video quality has improved. Awesome. That's right, Ray Marie. Increase the dryness effect. Very good. Saw that. All right, Ray is saying B for this one. What do you guys think? Let me go to this chat. Get a stool sample. Very good, Mike. Yeah. So A, Jasmine saying A, Anna saying A, Anthony. Let's see. Go back to this screen. How many screens open right now, you guys? So A is the correct answer. You guys know what you're talking about. However, still read the rationale, because sometimes your rationale may be off. Maybe you just lucked into the right answer. But here you guys knew this is a clear sign of C. diff. We really need to stop that medication, send in a culture and sensitivity so we can get an alternate antibiotic regimen started, because this patient does have an infection that we need to treat. We can't just have them not taking anything for that wound, right? And then also send that stool sample out to confirm our suspicions of C. diff. Awesome job, you guys. Go on to the next one. Which of the following is not a sign of skin cancer? A, sore that never heals. B, a new lesion that is growing and changing. C, painful lesions. D, irregular borders in asymmetry. I love that. A, B, C, D, E, that acronym, right? What does it stand for? A, B, C, D, E. Acronyms are good because they help us remember, okay, what does that A stand for? What does that B stand for? What does that C? Those are ways we can really be thinking about screening for skin cancer. Absolutely. Let me see. C, Ray and Marie says C, painful lesion. Kyle says HH. Kyle, I think that's the typo, A, B, C, and D. I know the text is small on Instagram. I apologize for that. All right, seeing a lot of C's, C, C, C. Awesome, you guys. Look at you. Okay. see. Painful lesion, is that in our ABCDE? No. So painful lesion is not a sign of skin cancer, though we still need to investigate what's going on, right? But skin cancer, that sore that never heals, big red flag. Lesion that's growing and changing, big red flag. Those irregular borders, asymmetry, right? That's the B in ABCDE. Awesome, awesome job, you guys. If you don't know ABCDE, go back, read it, read more about it. All but which of the following are physiologic changes of aging? So again, we're going to see a lot of geriatric in our primary care boards, right? Why? Our patient population is aging. So you got to get really comfortable with geriatric, especially if you don't see a lot of geriatric as a nurse. Maybe you do a lot of peds. You definitely want to be focusing a lot on those geriatric patients with our aging population. We're going to be treating them and caring for them a lot in primary care. All right, A, is a decrease in skin elasticity, B, thinning of skin, C, decrease in muscle mass, or D, decrease in body fat. So all but which of the following are physiologic changes of aging? What do you guys think? This is a tough one. Let's see what you said. All right, Nancy, that's warning signs of cancer. That's right. Those are warning signs. But what do you guys think? A, B, C, or D? It's a tough one. You can see the wheels turning. You guys are like, oh no. Anna says D. Hi, Anna. Good to see you. What do you guys think? Where's my other chat go? That'd be fair. All right. Sam Maria saying C. D. D. What do you guys think? What do you guys think? Seeing a lot of C's and D's. Okay, let's go with D, and that is correct. So remember, which of the following all but? So it's saying not a normal physiologic change of aging. And I see this with my students a lot. They get confused when, especially if English is not your first language. So you really have to be thinking about what is this question asking. So all but, meaning all of them are expected findings, physiologic findings of aging, except. So this is what is not an expected finding, right? And that decrease in body fat, aging can lead to increase in body fat and loss of muscle mass, right? And that's what we have to be thinking about. Why do we have to be thinking about this, not just for overall health, but when you're prescribing those medications, right? We need to think about that. All right. I think given that it's 12:30, it's going to be our last one. 17-year-old male patient presents with a moderate case of acne vulgaris. I love treating acne. This is my passion project for primary care. Treat your patients with acne. We can do a lot in primary care that is in our scope. That's all I'll say about that. I will go off on a tangent later. What is the initial treatment option for this patient? So 17-year-old male coming in for moderate case of acne. What is the initial treatment? So what are they asking? Initial, right? What are you going to try first line? Before jumping all the way to alternative agents, what is your first initial treatment? Remember, for acne, there's no universal scale, but they're telling you it's a moderate case of acne, right? So you don't have to necessarily be grading this as a mild, moderate, severe. They're telling you it's moderate, so it's pretty significant. Visually prominent, happening in multiple body areas. What do you think? What's going to happen? What's that initial treatment? Is it A, cryotherapy, B, topical retinoids, C, topical azelaic acid, or D, topical corticosteroids? What do you guys think? And this is just only one correct answer. So A, B, C, D. What do you guys think? All right. Seeing a lot of us. Hi, Jackie. Do you guys think A, B, C, or D? And for those of you who are just hopping on, remember this is for advanced practice. I'm seeing some C's and D's. All right. Topical retinoid is what we're going to go with to reveal the answer, and you guys are correct. Remember, we are not using topical steroids for acne. That is not a treatment option. It could make the problem worse. What is acne? It's really that pus either under the skin or just in that hair follicle on the skin. So if we're putting steroids on it, that's not really helping treat the pus, right? So acne, absolutely, we want to be talking about first line topical treatment with this patient. We haven't started topical yet. So if we wanted to, if it was leaning more towards severe, we could start with topical and get them on oral as well. But topical retinoids are going to be our first line. What are some things to think about with those topical agents, especially topical retinoids? Big thing. You really want to make sure their skin's going to be sun sensitive, so you want to make sure that you are educating them on that. Maybe they use it at night. They have to use sun protection, something ideally that is not going to create more acne and comedones. And then also making sure that they know it's going to dry their skin out too. So really talking to them about their skincare is going to be important. Now, you can use it topically in combination with benzoyl peroxide and retinoids. Those are typically our first line with topical treatments for acne. Then we can step it up to that oral agent, typically usually a tetracycline like doxycycline, if there are no contraindications. All right, awesome job, you guys. So this is what our Q bank looks like. We had a lot of fun. Was it spooky? Did I deliver on the Halloween theme of spooky? You guys are like, spooky, how? I was going with like spooky, gross derm conditions, but we didn't really get that many gross ones. So, but you guys have a wonderful Halloween, and I will be back on later for a story on Instagram. But I really want to wish you guys luck if you're studying, if you're in the middle of your semester, you're feeling a little burnt out, make sure you're taking some time for yourself. Enjoy the holidays, enjoy nature, go out even if it's cold, and keep up with the studying. And if you have any questions, you can reach out to me directly at advancedpractice@archerpulse.com. We have rebranded. We were acquired about a year ago, and so our name is transitioning from Archer Review to Archer Pulse. So you'll see a lot of that. But if you send an email to Archer Review, it's kind of hit or miss. Sometimes I get it, sometimes I don't. So reach out to my Archer Pulse email. So advancedpractice@archerpulse.com. If you want to meet one-on-one, I do mentoring sessions, tutoring sessions as well, or just reach out to me via email. Students love to reach out, tell me what you're struggling with and what I recommend for you, and I'd love to help you guys any way I can. Thank you so much for joining today. Enjoy the rest of your Thursday.